So we are already in the diastolic. Okay? So we are in the diastolic now. As we say, while it is deflating, you will hear the last sound. So that last sound is the second number, which we call it the diastolic. So now the number 10 is double checking for accuracy. What do we mean by double checking? It means to say only one checking or only one taking measurement of the blood pressure is not enough. So the American Health Association recommends taking a reading with both arms and averaging the readings. So it is not like, it is a guideline by the American Health Association to take on both arms. But we are taking on the left arm, just repeat it. So to check the pressure again for accuracy, at least you wait 5 minutes between readings. You have to wait after 5 minutes. So typically, the blood pressure is higher in the morning and it is lower in the evening. So if the blood pressure reading is concerned or mask or white coat hypertension is suspected, a 24-hour blood pressure study, it may be required to assess the patient's overall. So overall blood pressure profile. Because the doctor wants to check if it is really high, keeping it high or making it low. So what do you mean by a masked hypertension? It is associated with increased cardiovascular risk in both the untreated and the treated patients. So in contrast, why the doctor said so masked hypertension? It is a white coat hypertension. It is a cardiovascular risk. So doctors, when taking, like he found that the blood pressure is high on the first take, on the first reading, so he will think of this is a masked hypertension. It might be the patient is risk for any cardiovascular or for any heart problem in the future. Okay, so this is what we are talking about. The procedure, number 1, you have to sit the patient in a comfortable sitting position, right? So this is how it should be. It should be with the sitting position. You will ask the patient to sit and the hand is lying on the table and you will put your blood pressure monitor, the aneroid and the stethoscope. It should be, the hand should be in the level of the heart. So secondly, you will find it here that the nurse or the doctor is inflating. So it's starting to inflate the cuff. And the third, with the use of that the gauge, the round one. So the nurse with the left finger, with the left thumb on the diaphragm of the stethoscope. So, and the right hand is inflating the bulb. So she or he is looking into the gauge on the round gauge there. So we come into the oxygen saturation. So it is difficult to take the blood pressure, right? But anyway, once you are already there and you are already used to it, it will be easy for you. But for such, first timer to do it, it will be a little difficult. So now we go into what is the oxygen saturation. So the number 6, if we are taking the vital signs, it includes the oxygen saturation. It is the fraction of oxygen saturated hemoglobin relative to total hemoglobin unsaturated plus saturated in the blood. So this is the fraction. Oxygen saturation, hemoglobin relative to the total unsaturated and saturated in the blood. So the human body requires and regulates a very precise and specific balance of oxygen in the blood. So the normal arterial blood oxygen saturation levels in humans are 95 to 100%. So in the level, if the level is below 90, it is considered low and hypoxemia. So we have another medical term here, hypoxemia. Hypo means low, and xemia here is oxygen. Okay, so there is a low concentration of oxygen. So arterial blood oxygen levels below 80% may compromise organ function, such as the brain and the heart, and should be promptly addressed. Why we are taking the oxygen saturation? So we want to know whether it is still, the patient is still in normal oxygenation, because otherwise if it is below, so they are compromising the organs, the brain for the stroke and the heart for the heart attack. So continued low oxygen levels may lead to respiratory or cardiac arrest. This is how it happens when the patient is going to die of cardiac arrest or heart arrest or respiratory arrest. Oxygen therapy may be used to assist in raising blood oxygen level. So oxygenation occurs when oxygen molecules O2. O2 is the symbol for oxygen. So enters the tissue of the body, and for example, the blood is oxygenated in the lungs where oxygen molecules travel from air into the blood. Oxygenation is commonly used to refer to medical oxygen saturation. So now, what is the oxygen saturation for? It is the fraction of oxygen saturated as we talk about it, okay? And what are we going to take in the oxygen saturation? So we are going to take the pulse oximetry. So this is the procedure for taking the pulse and the oxygenation itself. So it is a combination of the pulse, peripheral oxygen, and the peripheral oxygen saturation. So the pulse oximetry, it is a method. It is used to estimate the percentage of oxygen bound to hemoglobin in the blood. So the approximation to saturation oxygen is designated as SpO2, peripheral oxygen saturation. Okay, so SpO2 is the abbreviation for the peripheral oxygen saturation. So the pulse oximeter consists of a small device. It clips only to the body, such as in the finger. So it is for the babies, we can clip it in the earlobe. For the infant, you can clip it in the foot. And it transfers its readings to a reading meter by a wire or wirelessly. So device uses light-emitting diodes in conjunction with a light-sensitive sensor to measure the absorption of red and infrared light in the extremity. So the difference in absorption between oxygenated and deoxygenated hemoglobin makes the calculation possible. So typically, more than 89% of your blood should be carrying oxygen. That's why when we are going to take it, the oxygen, the measurement of the oxygenation of our blood should be around 90, more than 90 or 95 to even 100%, 98, 99 or 100. So an oxygen saturation level of 95 is considered normal for most healthy individuals. So a level of 92% indicates potential hypoxemia or deficiency in oxygen reaching tissues in the body. So if the oxygen that you measured is less than 90, that means to say you must be alarmed because there is something that is happening for the oxygenation of the patient. So this is how the pulse oximeter is. If you are already have the experience or you have been in the healthcare facility, this is how you are going to see how the measurement of the pulse oximeter is. Okay, so it's been clipped. So what are the purposes of this oximeter measurement? So to check, number one, how well your heart is pumping oxygen through your body. Number two, it may be used to monitor the health of individuals with any type or the condition that can affect blood oxygen levels, especially when they are in the hospital. So these conditions include, what are the conditions? What are the disorders? What are the diseases that you will find the oxygen level is low? Number one, we have the COPD. It is the abbreviation for the chronic obstructive pulmonary disease. So it is where the person has a chronic, a long life case of obstructed, there is obstruction of the respiratory, the pulmonary, the way where the breathing comes from, the oxygen. So there is obstruction. So there is a low oxygen measurement. Asthma. When anybody from your family who has the asthma, so means to say they have difficulty of breathing. And in this case, the oxygenation is less. So when there is a pneumonia, means to say there is an infection in the lungs, so the oxygenation is also low. If there is lung cancer, so the oxygenation is low. If there is anemia, why anemia? Because in anemia, the oxygen, the blood, the red blood cells, which carries the oxygen to the circulation for the oxygen supply in the circulatory system is less. So the red blood cells is less. So the oxygenation that is going to be circulated around the body is poor. It is low. So that's why the patients who have anemia has low oxygen measurement. Heart attack or heart failure, the same thing. So they cannot breathe well. They have the breathing problem. They have the difficulty. So the oxygen saturation is low. For those congenital heart defects patients, those patients who are born with problem within the heart, so their oxygenation level is also low. Okay, so this is the procedure how we are going to take with the oximeter. So most commonly, you have seen the clip, right? So this clip is being clipped in your finger, either in the pointer or in the middle finger, or in the child earlobe, or in the baby's earlobe, or at the toe of the infant. It is just like a small pressure, but there is no pain, there is no pinching. So you will keep the probe for as long as it beeps. There is a beep, or there is a small screen that you will see. It will show the oxygen saturation. During the surgery, the probe is attached beforehand to the patients going to operating room, and once they are awake, until it becomes normal, that's the time they have to remove it. Sometimes it will only be used to take a single reading only. So once the test is over, the clip or probe will be removed, disinfect it, and record the measured result. Now about weight. For us, taking the weight normally is just like common. But in the healthcare facility, we need to take the weight as in the process. So the weight is defined as the body's relative mass or the quantity of matter contained by it. So giving rise to a downward force, the heaviness of a person. So once we are taking the weight, we need to know how heavy is the person is. So what are the importance of the weight? Why we want to take the weight? So number one, it decreases risk of health issues and disease. So we want to check whether this patient that we are going to take the weight, there is a decreased risk or they might have been going to be a risk for the health issues. Number two is a lifestyle change and not temporary fad. Most of the people taking the weight because they wanted to check their weight, because they wanted to check whether they are going to be, they are on diet and they are going to check the weight, whether it is reducing, it is losing. So a lifetime check or a lifetime change with the use of the weight weighing scale help them to check. Number three is being more active creates a healthier body. So nowadays, being active, so those who are going for the gym, so they are using the weight measurement to measure their body weight. So a better you. Why a better you? Just like for this time of summer. So you want to go to the beach. So you want to be a better you. You want to have a body beautiful, a beach body. So aging is inevitable, okay? So once you are aging, so you want to check your weight also, whether you are going to be in a higher side or you're going to be in the lower side. So how to check now the weight? There are key points. What do you mean by key points? They are like a guideline. So number one, recording and documenting an accurate patient body weight is a fundamental why for the screening of nutrition patients. They are valuable in monitoring fluid balance level or calculating medication doses. When a patient comes to the hospital, why you are why you are taking the weight, okay? So once they are taking the weight, the doctor is basing how to calculate the medication he or she is going to give to the patient. This is according to the body weight. How many tablets is she going to give the patient? So it depends on how many tablets is depend on the weight of the patient. So it is also a monitoring tool. Like for those nutritional screening, when they are on a nutrition diet uh, um, project, so the nutritionist is going to give them a nutrition diet. So in that case, they are monitoring the fluid balance, whether how many the patients is losing according to the fluid that the patient is using, is taking in. Number two, when nurses are key in ensuring an accurate measurement of body weight and patient risk and ongoing monitoring and intervention of appropriate nutritional care. So we, the nurses, the nursing aides, you are the key. You are the key to ensuring an accurate body weight measurement. So to prevent the risk of ongoing monitoring whether the intervention of the nutritional care is effective or it is not effective by the weight that you are going to take. Weight should not be considered as one of observation on admission. Why? Because it must be recognized as important tool. As I already informed you at first, weight is vital because it depends on how the doctor is basing on the medication, on the nutritional assessment, on the body fluids that is going to be ordered to the patient. Okay, so how to do or take the proper body measurement, body weighing measurement. So number one, it is not like us when we are taking it commonly in our household. At home, we used to take our weight in the bathroom or any surface, right? So here, in the hospital or any healthcare facility, we as the nurses or the nursing aide, we have to do it in a proper way. Number one, you have to place your scale on a flat surface. Okay? Why in a flat surface? Because you should not put it on a carved carpet or those carpet that is crumpled, bumpy tiles, or rugs, because it will cause to give you an inaccurate weight measurement. Number two, step on the scale. You have to step with both feet even and flat. Okay, maybe sometimes the people are just tiptoeing. So it should be flat, even, and flat on the weighing scale. You do not touch your hands. You ask your patient not to hold at anything while taking the weight because it will display inaccurate result. Three, you have to read the number correctly. Why? Because in numbering, in the weighing scale, you will find a number like a kilo or a pound. So these two has different calculation. A kilo is read by 1 or 2 or 3 kilos. But if the pounds, it is doubled. So if you are taking in a kilogram, you have to put it exactly on a kilogram meter. Okay? And if you are going to take it, if the doctor asks you, take it in pounds. So you have to put the meter, set it to the pounds. Because that is two different number that will give you. The pound is 1.1 kilo. 1 kilo is equivalent to 2.2 pounds. Okay, so the conversion is different. So you must be careful when taking a pound or a kilo. So a dial scale will be point to a number mark or a space between two marks to show how much you weigh. So in reading it accurately, in a kilo, you have to put, if you find like 10.2, you have to measure or you have to record it as in 10.2. You do not miss the 2 because that 0.2, that will be also included in the doctor's calculation of your medication. So you must be accurate in measuring. So number 4, it is the step of the scale. It is not like once you are done, you will just ask your patient to jump. No, you have to get out of that very carefully, very gently. So 1 foot at a time. Okay, so simply step off the scale is slowly 1 foot at a time. Number 5, record the number of the weighing scale. Okay, so as I told you, you have to record it accurately. Okay, recording or measuring height by the stadiometer. So why we are calling it stadiometer? It is the height measurement. Okay, the picture that I have showed you at first, there is an attached stadiometer. Okay, when your height is measured, you usually stand next to a device called stadiometer. So when you are standing on your foot on the weighing scale, the same time the nurse is going to take your height, the height measurement by the use of that stadiometer. So stadiometer is a long ruler. It is either attached on the wall or it is attached in the weighing scale. So it has a sliding horizontal headpiece that is adjusted to rest on top of your head. It's a quick way of accurately measuring your height. Okay? So in the weighing scale, we have the weight and the height that is called stadiometer. When taking the height, as we know, it must be you have to take off your shoes. It is common to take off the shoes. You must stand flat even on the weighing scale or on the floor. So if you are standing, you have to stand straight. Remove any headbands or remove any braids because it will add to your height measurement. So remove any bulky clothing also that is difficult to stand against the wall if you are going to stand against the wall. So stand with your feet flat on the floor with your heels against the corner if you are standing at the wall where the wall and floor meets. And make sure your head, your shoulder, and your buttocks are touching the wall. Stand up straight with your eyes looking straight ahead. You don't stoop. You don't look down. The line of your chin and your side should be parallel to the floor. Have someone place a flat object if you don't have, if you are just using the ruler, or if you are just using the tape measurement, if you are attaching it to the wall, so you don't have that horizontal flat ruler. So you will be using any flat object to put it on your top of the head so that you will be measuring your height. Lightly mark the wall with a pencil at the point where the ruler or book or other flat object meets your head. So use a tape measure, as I told you. If you don't have the stadiometer, you use the tape measure and post it at the wall. So take note of the measurement to the nearest 1/8 inch or 1/8 centimeter of an inch or point or 0.1 centimeter. Why again? Because this is very important for the doctors to take the measurement accurately for them to base what treatment they can give you, what antibacterial or antibiotic will give you, or for the nutrition assessment, how much calorie are they going to give you. So it is better for us as the nursing aides and the nurses to take it accurately and record it with the 1/8, 0.05, or 1 centimeter. Okay, you don't remove it. You have to add it while measuring or recording. Okay, so we have done with the vital signs. So now, how do you think you will be able to do it in an actual setting? It will be difficult. So it will be a difficult one. So yeah, I believe so. For the first timer, it will be difficult. But if you will come to in the practice, so they say practice makes perfect. Okay? So once we started to do it, we have to continue to practice it. So once you come in your place of work in the future, so you will be expert. Okay? So they will know, they will be happy that you will be in the team, that you are good in measuring accurately those vital signs. Okay, so they will put the trust on you as a team member, as a member of the healthcare. So once we are going to be in that physical assessment, in the competency or in return demo, so at first I'm going to show you, and then one by one, you have to show me. what you are going to do. You have to do it according to the step procedure that we talk about. And according to that, I'm going to grade you according to what you are showing it to me. Okay, so that will be, the lesson for the physical assessment. So as for now, the vital signs is the most important for the nursing aide or any healthcare professional to perform, to do the task whenever you come into a healthcare facility. Okay? So vital signs. Vital signs is the most important task of a nursing aide. So we have done in the vital signs, we have to measure what? Body temperature. What else? The vital signs. What are the vital signs? The pulse rate or the heart rate, respiration rate,
blood
the
pressure,
blood pressure,
oxygen
the height,
saturation,
the weight, and the oxygen saturation. So all of those, we have to take on more time to practice. We have to try to do it perfectly. If not perfect, at least almost to perfect. Okay? So we have to do it. So I hope that today we have done our vital signs. And I think let me check if I have a quiz for a vital sign. Are you ready for the quiz? As usual, you are ready for the quiz? As I see you, you are all listening. So that means to say, everybody is listening, right? So everybody is listening. So is there any question? So is there any question from our lesson for today? So vital signs. No. So if there is no other question for us to discuss, no other questions? Everybody has understood well? So you are ready to take the physical assessment? So we have to start doing our physical assessment. You start it at home. You feel your pulses. Where are those pulses located? And then you start doing the counting according to the process, according to the steps and procedure. Okay, because it is you have to do it in our physical assessment or the return demo. One by one, I will ask you to do it. So from now on, for the pulse rate, you have to check where are those pulses sites. So we have 9 pulse sites, right? Okay, so remember still the 9 pulse sites? Still remember? Still remember the 5 ways of taking body temperature? So you remember the process of how to take the blood pressure?
10 process.
So you have to recite to me, the steps of taking the blood pressure, okay, while doing it. Or taking the vital signs as in body temperature, how you will do the rectal, how you will do the oral, how we will do the tympanic, blood pressure, is one of the most important thing. Oxygen saturation is easy because you will just clip it. As long as you know where is your pointer and your middle finger, the earlobe of the baby or the foot of the infant, so you can measure the oxygen saturation. Okay, a little bit there is the blood pressure, as I have seen with my student in the physical assessment. So you have to practice the blood pressure, even taking the pulse rate with multiplying into 4, multiplying into 2 to make it 1 minute. So a little bit confusing, but you will get over it. You will be competent enough through the practice. Okay, so what else is there? The height and the weight. For the babies, for the infants, because there is a baby weighing scale. So it's at least a little bit easy. We are just leaving the pampers or sometimes the full of the body of the baby's body clothing. We are taking it off when taking the measurement or the body measurement for the baby's weight. We are taking off everything, even the pampers. Okay, because we need to take the accurate measurement. How the child of 3 years old, you will ask the child of 3 years old stand on the weighing scale. Is possible or impossible?
Possible.
The child of 3 years old, they will not stand on the weighing scale.
You should have
Just
to
jumping.
hold it.
They will
Just-
jump.
Jumping,
Okay?
jumping.
They
Yeah.
will jump. 3 years old are jumping. They are toddlers. So what we need to do with them, there is a seat that is a seat weighing scale for the toddlers. Okay, so they can sit there, but they are expensive. So what we are doing in our pediatrics, we are asking the mother to weigh first. And then the next is holding the baby or the child. So, and then minus it.